My name is Dr. John Corbett. I'm a credentialed sleep physician and a neurologist to whom you've been referred because of a sleep problem. I've prepared a DVD, the purpose of which is to give you a better understanding of the commoner sleep problems, and in particular snoring and obstructive sleep apnea. Snoring is something that all of us have had experience of. Sleep apnea, on the other hand, is a specialised term. The word apnea is a Greek word which means no breathing. So sleep apnea is a condition in which breathing temporarily and intermittently ceases during sleep. To understand why sleep apnea and snoring occur, you need to understand a little about the upper airway. You will see shown on the slide here numbers 1 and 4. The area between these two numbers is the hard palate. The area between numbers 4 and 5 is the soft palate and what is called the uvula. Number 6 marks the tongue. Numbers 7 and 8 indicate the soft tissues at the back of the pharynx. When we are awake, the muscle tone throughout our body is high. When we fall asleep, the reverse applies and muscles become relaxed. Now, in the mouth and throat, there are a lot of muscles. The tongue is mainly muscle, and when we fall asleep, all of these muscles, the tongue and those at the back of the throat, relax. Because of the effects of gravity, the tongue then sags back, and especially if we are lying on our back, the tongue slides back into the back of the throat and tends to obstruct the airway. As the airway becomes narrowed due to the effect of this muscle collapse, the only way for our body to breathe in the right amount of air is for the speed of airflow to increase. As that happens, the effect is very much like the trailing edge of a sail in a sailing boat. That high velocity of air travelling past the soft tissues in the throat cause vibration. That in turn makes us snore, and particularly if our mouth is open, that snoring noise is projected. If the narrowing of the throat is too great, airflow can stop completely and we have what's called sleep apnea, or in a lesser state, hypopnea. If the narrowing of the throat is too great, airflow can stop completely and we have what's called sleep apnea, or in a lesser state, hypopnea. There are a number of conservative treatment options, but one of the simplest is to learn to sleep exclusively on the side. This often helps because of the fact that the tongue, in a way, is like a plug fitting a hole. If we sleep on our back, the shape of the tongue fits the shape of the throat, so it blocks it off more easily. If we sleep on our side and fall asleep, when the tongue collapses as its tone falls, it doesn't obstruct as easily. It tends instead to sag to one side and leave a space for air to flow. There are quite a lot of ways of achieving sleeping on your side. On this slide you'll see that I've listed a number of other conservative measures. An important one for heavy drinkers is to reduce the amount of alcohol. Others may need to reduce the consumption of sedatives at night. The reason for this is that both alcohol and sedatives cause excessive muscle relaxation, and they make snoring and sleep apnea considerably worse. If you do need to take sedatives, you'll probably find that your general practitioner will prescribe one of the short-acting ones, and mostly you'll be advised to use that type of medication only when you need it. I've also listed cigarette smoking. Everyone knows that that's bad for health, but it's important in sleep disorders because it causes swelling or edema of the tissues at the back of the throat and also the nose at times. Because of that, it magnifies airway obstruction and generally makes snoring louder and apnea more severe. There are a lot of dental splints available. They range enormously in price and design, but all of them have the same basic principle. They work on the principle that the tongue is attached to the lower jaw, so if the lower jaw can be pulled forward, it pulls the tongue with it, and that opens the airway. Sometimes that treatment will have a good effect, particularly if the problem is one of snoring, and especially if it's relatively soft snoring. The more severe the snoring, the less likely it is that dental splints will do the job. Now, that wouldn't matter very much if dental splints were cheap. Unfortunately, they're not. They typically cost about $500 or between $500 and $1,500. That's a lot of money for a treatment which may not work. Another problem is that about 50% of patients experience side effects. Sometimes they're relatively short-lived. For instance, dental pain can be a problem. Temporomandibular joint pain can occur. Many patients find excessive salivation, but over a period of time that will very frequently settle. Over a longer period of time there are more serious problems. One of these is that because these devices are orthodontic, they work by pulling on the teeth. Over a period of time the teeth can be pulled into another shape, so that in say 2 years there's about 10% of people will have an altered bite. In a period of 5 years that number rises to about 30%. Another concern is that some of the dental devices, and particularly the cheaper ones, will fit up over the teeth, and they prevent saliva lubricating the teeth. They also can lead to gum problems. When that occurs, there can be dental decay. Quite a lot of cost can follow. I think the moral of the story is that it is worth making sure whether a simple conservative treatment approach like sleeping on the side, losing weight, stopping cigarettes will do the job. If so, there are a lot of general health benefits to be gained anyway, a lot of money to be saved, and there's no logic in proceeding to using a dental appliance or the so-called mandibular advancement splints. Let's talk about surgery now. Surgery was quite popular about 10 years ago, quite a lot less popular now, but it's still used and sometimes there's a place for it. One of the key problems also is that surgery on the soft palate is relatively expensive, and most patients find that it's very painful. What this leads me to say is that it is not a good idea to rush into surgery or to rush into buying a mandibular splint. If you're thinking about it, and if conservative measures have failed or for some reason are not appropriate in your particular case, have a good talk to your doctor about it before making a decision. In the average patient, if conservative treatment fails, the most effective treatment, particularly for a patient with severe sleep apnea, the most effective treatment is what's called continuous positive airway pressure, CPAP. CPAP works by keeping the airway open. It does this by splinting it with an internal positive pressure. This is delivered by an external air pump connected via tubing to a face mask which is worn throughout the night during sleep. Now, the machine doesn't breathe for you, it doesn't provide oxygen, it simply pumps room air at a pressure high enough to keep the airway open, and that allows airflow to continue throughout the night and comfortable breathing to be achieved. This method is by far the most successful way to treat sleep apnea. In the process, it also overcomes snoring. Let me round off by saying that we spend about a third of our life asleep. The quality of sleep has a massive impact on the quality of the rest of our life. If you have a sleep disorder, snoring, sleep apnea or some other disorder, it can normally be diagnosed. These days it can mostly be treated. When that occurs, usually there's a big improvement in overall level of health and in overall quality of life.